Chris, this is Venk with Always on EM. Thanks so much for being here at ACEP. Obviously, I know you, but our audience may not, and we certainly don't know your work that you're presenting. Would you mind sharing a little bit about yourself and the work that you have here?
Absolutely. Thanks for the opportunity. And yeah, hello here from Las Vegas and ACEP 2024. I'm Chris with Mayo Clinic Ambulance. I'm a quality coordinator within the ambulance service, and I'm presenting here at ACEP on medication errors and a study that we did within our ambulance service about our medication error rate. The subject of this one is medication errors. Are our numbers correct? It's a mixed method study within a large multi-state ground and air ambulance service, which is Mayo Clinic Ambulance. For those of you that don't know about Mayo Clinic Ambulance, we are a air and ground service based out of Rochester, Minnesota, but provide service to 16 cities within Minnesota and Wisconsin and cover a population of about 1 million folks. So our study here was specifically to look at our medication error rate. Within our ambulance service, our self-reported medication error rate is 0.1%. We decided that perhaps that's not correct, and so with the help of some subject matter experts, such as our pharmacists at St. Mary's, they told us that is a fantastically low self-reported number, and so low that it probably isn't correct. So we got to looking at a couple different things to try and determine what our actual number might be. We used a QA discovered medication errors, which is where our QA specialists within the ambulance service review a portion of our total number of calls, in this case 6% of the total call volume, and they discovered that we had a medication error rate of 1.2%. We sent out a survey to the clinicians within the ambulance service looking for responses on reporting of medication errors, if there were barriers to reporting or the reasons that people did or did not report medication errors. We found that some very interesting information within that as to the reasons that people do and don't report their medication errors. But the most important part of this study was the observational portion, which was where we were able to observe our clinicians within the ambulance service during simulated care scenarios as part of their ACE training, which is their annual competency in education. The education department within Mayo Clinic Ambulance Service had set up these simulated care scenarios where our providers, based on their credentialing level of EMT, paramedic, flight paramedic, or flight nurse, were asked to provide medications in these scenarios. Through these scenarios, an error rate across all the medications that were provided was found to be around 10%, which is significantly higher than our self-reported error rate of 0.1%. So the conclusion to this was that the true prevalence of medication errors within our agency is likely closer to the 10% observed in the simulated care scenarios. But the next step to this valuable information is what can we do about it? So we're currently working on a root cause analysis for why medication errors occur within our ambulance service and looking for system factors that we can improve to make the error rate decrease for our clinicians.
Do you think that self-reporting is likely to be, or let me rephrase that, do you think people underreporting their errors when it's self-reported like this is common in other settings or unique in this setting?
So we utilized the fine folks at the Mayo Clinic Libraries to do a literature search for us on this topic when we started delving into it. And this is closer to what is seen in other settings within the hospital, whether it's inpatient or outpatient settings in the emergency room. Error rates are closer to that 10% or sometimes higher in certain settings.
And then do you have a sense of why people might underreport
So
errors?
I think there's a number of reasons and factors that could go into that, but the number one reason that we've discovered through the QA discovered medication errors was that they just didn't realize that they had made the error in the first place.
Yeah.
Not knowing that you've made an error makes it very difficult to report that error.
That makes sense.
And so, like I say, putting in processes that allow whether it's weight-based dosing, using hand-heavy or other apps that allow us to calculate those doses. Like I say, putting in system fixes that allow our clinicians to not make those mistakes in the first place are important. But not knowing that you made the error is one. Fear of retribution is another one. The people are afraid to report the mistake that they made.
Right.
Another factor that was revealed within our survey was that they didn't feel that they had caused any harm to the patient, so they didn't feel that it was important to report. So there's a multitude of factors that go into people not reporting or reporting, but
that makes sense. Well, this is really interesting, and I really appreciate you taking the time to share this with us. I hope you have a lot of fun here in Las Vegas, and thank you so much.
absolutely. Thanks for your time. I greatly appreciate it.
Perfect.